Hi, well, my name is Courtney DiNardo, and I'm from the University of Texas MD Anderson in the Department of Leukemia. And today I will be addressing two questions. The first question is in respect to the Viale-A trial that was just reported as a late breaker abstract at EHA. And the question was, should azacitidine with venetoclax become the standard of care for older patients with AML? And I think that's the short answer is yes. I think this was a really compelling and well-performed confirmatory randomized placebo-controlled phase 3 study, which showed very consistently across the board a improvement of the combination of azacitidine with venetoclax compared to azacitidine alone. And just kind of going through, some of the data very briefly in terms of response rates. With azacitidine alone, we saw a composite remission rate of about 28%. That's what we would expect to see with azacitidine alone. We saw a response rate that more than doubled with the combination, 66%, compared to patients that take usually, 4 cycles or so to respond to azacitidine. We saw responses occur within the first cycle. We saw a increased incidence of transfusion independence in patients that were treated with the combination, a improvement in responses across the board, really, regardless of age or performance status or genomic mutation status. And then, of course, the most important thing is that improvement in overall survival. That was, of course, the primary endpoint. The whole point is to say, is this combination leading to an improved, clinically meaningful improvement in survival of our patients with newly diagnosed AML? And that was also very, very significant. So compared to about 10 months that we saw with azacitidine alone, which is again exactly what we would expect to see based on our historical expectations, we saw an improvement to 15 months, 14.7 to be exact. So again, showing that that this combination together is an effective strategy, and I think it really should be considered as the new standard of care.